As a physician with over 25 years of experience treating adults over 50, I can tell you this: joint pain doesn't just come with age. Yes, it's common, but that doesn't mean it's normal or inevitable. I've had countless patients walk into my office and say something like, "Doc, my knees are stiff in the morning, my hips ache after sitting, and my hands hurt when I open a jar, but I guess that's just part of getting older, right?" Here's what I always tell them: aging may play a role, but it's often not the root cause. In fact, most joint pain I see in adults over 50 isn't caused by age itself, it's caused by daily habits. Small, seemingly harmless things you do every day that slowly wear down your joints over time. Whether it's the way you sit, the shoes you wear, how you sleep, or what you eat, these repetitive actions create stress on your joints. And when that stress builds day after day, year after year, it can lead to inflammation, stiffness, chronic pain, and eventually, loss of mobility. The truth is, your joints aren't just victims of time, they're shaped by your choices. And the good news? That means you have the power to protect them. If you're over 50 and starting to feel the wear and tear, or if you simply want to stay active and independent well into your later years, I urge you to pay close attention. In this article, I'll walk you through the most common daily habits that silently damage your joints and show you how to fix them before they turn into bigger problems. Let's take a closer look at what might really be behind your joint pain, and what you can start doing today to stay strong, mobile, and pain-free. Marcus Wells, board-certified physician, healthy aging specialist. According to recent studies, the average American adult over 50 spends more than 7 hours a day sitting, whether it's relaxing in front of the TV, commuting, working at a desk, or using a smartphone or tablet. At first glance, sitting may seem harmless, but when done for long periods without regular movement, it slowly and silently erodes joint health, especially in the hips, knees, and lower back. Why prolonged sitting damages your joints after 50? As we age, our joints naturally become more vulnerable to wear and tear. Add sedentary habits to the mix, and the damage accelerates. Here's what happens to your body when you sit too long. Hips tight. Extended sitting shortens the hip flexor muscles, reducing range of motion and causing discomfort. Knees stiffen. Keeping your knees bent for long periods can lead to stiffness, making it harder to climb stairs, walk long distances, or get up from a chair. Circulation slows. Sitting decreases blood flow to the legs and joints, which reduces oxygen and nutrient delivery, vital for joint repair and lubrication. Cartilage weakens. Cartilage, the smooth tissue that cushions your joints, depends on movement to stay healthy. Lack of movement means less nourishment, more friction, and increased risk of joint degeneration. For adults over 50, these effects are even more pronounced. Recovery time is slower, inflammation tends to linger longer, and once mobility begins to decline, it becomes increasingly difficult to reverse. The long-term risks of a sedentary lifestyle. If sitting for long hours becomes a daily habit, it can lead to chronic lower back pain, hip bursitis, knee stiffness and swelling, muscle atrophy in the legs and core, increased risk of developing osteoarthritis. These issues don't just cause discomfort, they can drastically affect your independence and quality of life as you age. What you can do: simple daily fixes to protect your joints. The good news is that even small, consistent changes can protect and even improve joint function. You don't need a gym membership or a complicated fitness plan, just a commitment to move more throughout your day. Here's what I recommend to my patients over 50. Stand and stretch every 30 to 60 minutes, set a timer if needed. Even 2 to 3 minutes of light movement helps reduce stiffness and boost circulation. Walk during phone calls. Whether you're on the phone with family or catching up with a friend, turn that time into a mini walking session around your home or yard. Use a supportive, ergonomic chair, especially if you spend time at a desk. Choose a chair that supports your spine and encourages good posture. Avoid soft, sagging chairs that make you sink. Incorporate joint-friendly movement into your routine. Gentle exercises like walking, water aerobics, tai chi, or stretching can help maintain flexibility and strength without stressing your joints. Final thought. You may not be able to eliminate sitting altogether, and that's okay. But being intentional about moving regularly throughout the day can significantly reduce your risk of joint damage. Think of it this way: motion keeps your joints alive. If you're over 50, protecting your mobility starts with your daily habits. Get up, stretch, move. Your joints will thank you now, and years from now. 2. Skipping warm UPS before, a costly mistake for your aging joints. Staying physically active after 50 is one of the most powerful things you can do for your long-term health. Whether it's brisk walking, swimming laps, playing pickleball, or hitting the gym, consistent movement helps protect your heart, brain, and bones. But there's one critical step that far too many older adults skip, and it's silently increasing the risk of joint pain and injury. That step is the warm-up. Failing to warm up properly before physical activity is one of the most common, and most damaging, mistakes people over 50 make. While it might seem like a minor detail, jumping into movement without preparing your body can lead to pulled muscles, joint inflammation, and long-term mobility problems. Why skipping warm ups is dangerous after 50. As we age, our muscles naturally lose elasticity and become more prone to stiffness. Our joints also produce less synovial fluid, the natural lubrication that protects bones from grinding and reduces friction during movement. That means cold, stiff muscles and joints are far more vulnerable to strain, tearing, or irritation. Without a proper warm-up, muscles remain tight, increasing the chance of muscle strain. Joints move less efficiently, which can worsen stiffness and discomfort. Blood flow is limited, reducing the oxygen and nutrients your tissues need during exercise. Balance and coordination may be impaired, raising the risk of falls. In short, skipping a warm-up sets your body up for failure, especially if you're dealing with age-related issues like arthritis, tendinitis, or past injuries. What a proper warm-up should look like for adults over 50. The goal of a warm-up is to gradually increase your heart rate, gently loosen your muscles and joints, and mentally prepare your body for movement. For older adults, the warm-up should be low-impact, controlled, and focused on full-body motion. Here's how to warm up safely and effectively. Spend at least 5 to 10 minutes warming up before any physical activity. Start with light cardio. Try slow marching in place, arm swings, or gentle stepping side to side. The idea is to gradually raise your body temperature. Include dynamic stretches. Move your body through a comfortable range of motion, such as shoulder rolls, torso twists, leg swings, or ankle circles. Focus on joint mobility. Give extra attention to areas that tend to stiffen with age, such as the hips, knees, and shoulders. Controlled breathing helps your muscles relax and prepares your nervous system for more intense movement. If you're preparing for walking, warm up with slower walking and exaggerated arm swings. For strength training, warm up with lighter sets or bodyweight versions of the exercises you plan to do. If swimming, try shoulder circles and arm raises poolside first. What not to do? Avoid static stretches, such as holding a hamstring stretch for 30 seconds before your workout. While stretching has benefits, static stretching before activity can actually reduce strength and stability in older adults. Save that for the cooldown. Also, don't rush your warm-up. Doing too much too quickly can be just as risky as skipping it altogether. The long-term benefits of a proper warm-up. A warm-up isn't just about avoiding injury in the moment, it's a long-term investment in joint health. Regular, proper warm-ups can improve flexibility and range of motion, reduce post-workout soreness, enhance coordination and balance, prevent flare-ups of arthritis and tendon pain, support longevity in your fitness routine. For adults over 50, consistency matters. Every time you move, you're either protecting or damaging your joints. A simple 5-minute warm-up can be the difference between pain and progress. Bottom line, if you're over 50 and serious about protecting your joints, skipping warm-ups is a risk you simply can't afford. The body changes with age, and those changes demand smarter preparation. Whether you're walking around the block or lifting weights, always give your joints the gentle activation they need before getting into motion. Remember, movement is powerful, but only when done safely. A warm-up isn't optional, it's essential. Unfortunately, many people over 50 underestimate how important proper footwear is for maintaining healthy joints. Wearing the wrong shoes can cause serious problems not just for your feet, but also for your ankles, knees, hips, and lower back. Unsupportive footwear, especially sandals without arch support, high heels, or old, worn-out sneakers, can lead to poor foot mechanics. When your feet do not receive adequate support, it affects your body's alignment. This misalignment causes uneven pressure and stress on your joints, often leading to pain and discomfort that worsens over time. Foot-related issues are one of the most commonly overlooked reasons for joint pain in older adults. Many people focus on treating symptoms in the knees or hips but fail to recognize that the root cause often begins with the feet. Conditions such as plantar fasciitis, flat feet, or improper pronation, rolling inward or outward of the foot, can cause a chain reaction affecting your entire lower body. Why proper footwear matters more after 50. As you age, your feet naturally lose some of their padding and flexibility, making them more vulnerable to stress and injury. Wearing shoes that do not offer sufficient arch support or cushioning puts extra strain on your joints. For example, running or walking in shoes that have lost their shock absorption abilities forces your joints to absorb more impact, accelerating wear and tear. How to protect your joints with the right shoes. Choose shoes with good proper arch support helps maintain correct foot alignment, reducing stress on your ankles, knees, and hips. Look for adequate cushioning and shock absorption. Shoes with good padding absorb impact forces, protecting your joints from repeated shocks during walking or standing. Replace walking or running shoes every 6 to 12 months. Even the best shoes lose their support and cushioning over time. Regularly replacing them ensures your feet and joints stay protected. Avoid high heels and unsupportive sandals. High heels shift your body weight forward, increasing pressure on your knees and forefoot. Flat sandals without support offer little protection. Consider custom orthotics. If you have flat feet, high arches, or other foot problems, custom orthotics prescribed by a podiatrist can correct your foot mechanics and relieve joint stress. Consult a podiatrist if you experience persistent foot or joint pain. Early professional evaluation can identify foot-related issues before they lead to serious joint problems. By choosing the right footwear and maintaining good foot health, you can significantly reduce joint pain and improve your overall mobility. Taking these simple but effective steps can help you stay active and independent well into your 50s, 60s, and beyond. Ignoring daily inflammation, the silent threat to your joints after 50. Chronic low-grade inflammation is one of the most overlooked yet damaging factors affecting joint health in people over 50. Unlike acute inflammation, which is your body's natural response to injury or infection, chronic inflammation persists quietly over months or years. This ongoing inflammation silently damages the tissues that support your joints, leading to pain, stiffness, and accelerated joint degeneration. For many Americans over 50, chronic inflammation is often driven or worsened by everyday dietary habits. Regular consumption of processed foods, high amounts of added sugars, refined carbohydrates, and unhealthy fats can all contribute to increasing inflammation in the body. Additionally, a diet low in omega-3 fatty acids, essential fats known for their anti-inflammatory properties, further tips the balance toward joint damage. Over time, this chronic inflammation harms your joints in several key ways. Cartilage break. Inflammation accelerates the wear and tear of cartilage, the protective cushioning between bones, leading to pain and reduced mobility. Tendon and ligament inflamed tendons become less flexible and more prone to injury. Worsening arthritis symptoms. For those already suffering from arthritis, chronic inflammation intensifies pain, swelling, and stiffness, significantly affecting quality of life. How to combat inflammation through diet. The good news is that inflammation is reversible, especially when you adopt an anti-inflammatory lifestyle. Here are some effective nutritional strategies to protect your joint. Incorporate anti-inflammatory. Focus your diet on whole, nutrient-dense foods known to reduce inflammation. Berries, such as blueberries, strawberries, and raspberries, rich in antioxidants. Leafy greens like spinach, kale, and Swiss chard, packed with vitamins and minerals. Turmeric, a powerful spice containing curcumin, a natural anti-inflammatory compound. Fatty fish such as salmon, mackerel, and sardines, excellent sources of omega-3 fatty acids. Nuts and seeds, particularly walnuts and flax seeds, which provide healthy fats and antioxidants. Limit pro-inflammatory foods. Reduce or avoid foods that trigger inflammation, such as processed and packaged snacks, sugary desserts and beverages, fried and fast foods. Excessive alcohol consumption. Stay well. Drinking enough water is essential for joint lubrication and helps flush out toxins that can worsen inflammation. By paying close attention to your diet and making smart food choices, you can significantly reduce daily inflammation. This simple but powerful approach protects your joints, relieves pain, and helps maintain your mobility and independence well into your later years. 5. Sleeping in bed. How your nighttime habits could be hurting your joints. Many people underestimate the impact that their sleeping position can have on joint health, especially after the age of 50. What might seem like a simple habit, how you position your body during sleep, can actually play a significant role in either protecting your joints or contributing to joint pain and stiffness. As we age, our joints become more vulnerable to wear and tear, and poor sleeping posture can place unnecessary stress on key joints such as the hips, shoulders, knees, and spine. For example, curling up tightly in a fetal position throughout the night may cause your joints to stay compressed for hours. Similarly, consistently sleeping on one side without proper support can lead to uneven pressure on your shoulders and hips. These positions limit blood flow and joint lubrication, which can increase inflammation and discomfort by morning. If you frequently wake up with aching hips, shoulders, or knees, your sleeping posture might be the culprit. Over time, poor alignment during sleep can contribute to chronic joint problems and may worsen existing conditions like osteoarthritis. The fix: To minimize joint strain while you sleep, aim to maintain a neutral spinal alignment. Sleeping on your back is generally considered the best position for joint health because it distributes your body weight evenly and reduces pressure on your joints. If you prefer sleeping on your side, placing a supportive pillow between your knees can help keep your hips aligned and reduce stress on your lower back and knees. Additionally, investing in a high-quality mattress and an ergonomic pillow designed to support natural spinal curves is crucial. A mattress that is too soft may allow your body to sink in awkward positions, while a mattress that is too firm can create pressure points on your joints. Look for medium-firm mattresses with good contouring ability to support your body properly. Proper sleep posture, combined with the right bedding, helps ensure your joints stay aligned, reduces inflammation, and allows your body to repair overnight. If joint pain persists despite improving your sleep habits, consult with a healthcare professional who can recommend personalized strategies for better joint care. Avoiding strength. Why it's one of the biggest mistakes people over 50 make for their joint health. Many adults over 50 mistakenly believe that strength training is only beneficial or even safe for younger people. This misconception often leads to avoiding resistance exercises altogether, which can have serious consequences for joint health and overall mobility as you age. Why strength training is crucial after 50. As you age, your muscles naturally lose mass and strength in a process called sarcopenia. This loss weakens the muscles that support your joints, such as those around the knees, hips, and shoulders. When muscles become weaker, your joints experience increased stress and instability, accelerating cartilage wear and contributing to joint pain and conditions like osteoarthritis. Strong muscles act as shock absorbers and stabilizers for your joints, reducing the strain placed on bones and connective tissues during daily activities like walking, climbing stairs, or lifting objects. Without adequate muscle strength, joints are more vulnerable to injury, inflammation, and chronic pain. The consequences of avoiding strength training. Avoiding resistance exercises means missing out on one of the most effective ways to slow joint degeneration and maintain your independence. Weak muscles lead to poor posture and altered movement patterns, which can cause abnormal joint loading and further damage. Over time, this creates a vicious cycle. Joint pain leads to less activity, which causes more muscle loss, and the joints deteriorate faster. Research consistently shows that adults who engage in regular strength training report less joint pain and better physical function compared to those who do not. This evidence makes it clear that strength training is not just safe for people over 50, it's essential. How to safely incorporate strength training into your routine. If you're new to strength training or have existing joint issues, it's important to start slowly and use proper techniques. Here are practical tips to help you. Aim to do resistance exercises 2 to 3 times per week. Consistency is key to building and maintaining muscle strength. Use bodyweight exercises like squats and wall push-ups, resistance bands, or light free weights. These options provide effective muscle engagement without excessive joint stress. Focus on controlled movements and proper posture. Avoid rushing through repetitions or lifting weights that are too heavy. Consider working with a physical therapist or certified personal trainer who has experience with older adults. They can tailor exercises to your abilities and help you avoid movements that could aggravate joint problems. Listen to your body. It's normal to feel some muscle soreness, but sharp or persistent joint pain is a warning sign. Modify exercises or rest as needed. The bottom line, strength training is a cornerstone of healthy aging and joint preservation. By building stronger muscles, you reduce the mechanical stress on your joints, improve balance, and support your body's natural movement patterns. Avoiding strength training may seem like the safer choice at first, but in reality, it puts you at greater risk for joint pain, injury, and loss of independence. Taking the time to incorporate resistance exercises into your weekly routine is one of the best investments you can make in your long-term health. Then, pushing through the pain. Why ignoring joint discomfort can cause lasting damage. One of the most common mistakes people over 50 make is ignoring joint pain, thinking it's just a normal part of aging or something that will go away on its own. This mindset of pushing through the pain during daily activities or workouts can actually cause serious, long-term damage to your joints. Pain is your body's natural warning signal. It tells you that something isn't right. When you dismiss or ignore this discomfort, you risk worsening the underlying problem. Continuing to stress a painful joint without proper care can accelerate the breakdown of cartilage and soft tissues, leading to chronic inflammation, increased joint wear, and even permanent mobility loss. Many adults over 50 assume joint pain is inevitable, but the truth is that persistent pain is a sign that your body needs attention and rest. Pushing through pain may provide short-term relief or allow you to complete a task, but the long-term consequences include increased risk of arthritis flare-ups, ligament damage, and potentially more invasive treatments down the road, such as injections or surgery. How to protect your joints instead. Listen to your body. When you feel sharp, stabbing, or persistent joint pain, don't ignore it. Acknowledge the warning and take a break. Rest and recover. Give the affected joint time to heal by avoiding activities that worsen the pain. Gentle movement is fine, but avoid overloading. Use ice or heat therapy. Applying ice can reduce swelling and numb pain in acute stages, while heat helps relax muscles and improve blood flow in chronic discomfort. Monitor your symptoms carefully. Track the intensity, duration, and triggers of your joint pain to share with your healthcare provider. Seek medical advice if pain persists. If joint pain lasts longer than a few days, interferes with daily activities, or worsens over time, consult a doctor or a specialist. Early diagnosis and treatment can prevent progression and improve quality of life. By respecting your body's signals and avoiding the trap of pushing through joint pain, you can preserve your joint health, reduce inflammation, and maintain your mobility well into your golden years. When to see a doctor about your joint pain. Understanding when it's time to seek professional medical advice is crucial for maintaining your joint health, especially if you're over 50. While occasional aches and stiffness are common as we age, certain symptoms should never be ignored because they may signal underlying joint problems that require prompt treatment. Here are the key warning signs that indicate you should schedule an appointment with your healthcare provider. Swelling in your joints. Persistent or sudden swelling around your joints is a red flag. Swelling can be caused by inflammation, fluid buildup, or injury. If you notice your knees, wrists, fingers, or any other joint appearing visibly swollen and it doesn't improve within a few days, it's important to get it evaluated. Untreated swelling may lead to further damage or infection. Pain that wakes you up at night. Joint pain that disrupts your sleep is more serious than typical daytime discomfort. Nighttime pain could indicate conditions such as osteoarthritis, bursitis, or even more serious issues like rheumatoid arthritis. If you find yourself frequently waking up due to aching joints, don't dismiss it. This symptom deserves a thorough medical assessment. Difficulty walking, standing, or performing daily activities. If joint pain or stiffness is interfering with your ability to walk, stand, climb stairs, or carry out everyday tasks, it's time to see a doctor. Limited mobility can greatly affect your independence and quality of life. Early diagnosis and treatment can help slow joint deterioration and improve function. Clicking, locking, or feeling instability in joints. Unusual sensations like clicking, popping, or locking joints may signal mechanical problems within the joint, such as cartilage damage or meniscus tears. Instability, feeling like your joint might give out, can increase your risk of falls and injuries. These symptoms warrant medical evaluation to identify the cause and develop an appropriate treatment plan. Why early detection matters. Early intervention is key to preventing long-term joint damage. Conditions like osteoarthritis and other degenerative joint diseases worsen over time but can often be managed effectively if caught early. A healthcare professional can recommend treatments ranging from physical therapy and lifestyle changes to medications or, in some cases, surgical options. Delaying medical care may lead to chronic pain, reduced mobility, and a decreased ability to perform everyday activities. By recognizing these warning signs and consulting your doctor promptly, you take an important step toward preserving your joint health and maintaining an active, independent lifestyle. Marcus Wells. As a physician with more than 25 years of clinical experience working closely with adults over 50, I have witnessed firsthand how small, often unnoticed daily habits can gradually and silently erode joint health. These subtle behaviors accumulate over time and become major contributors to chronic joint pain, stiffness, and mobility loss issues that affect millions of Americans as they age. The encouraging news is that it's never too late to regain control over your joint health. You don't have to rely on costly supplements or commit to intense, high-impact workouts that might do more harm than good. Instead, what truly matters is awareness and consistency in making smart, manageable lifestyle changes. Simple yet effective adjustments can make a profound difference. Increasing your daily movement with light stretching and regular walks, choosing footwear that properly supports your feet, maintaining good posture throughout your day, and adopting an anti-inflammatory, nutrient-rich diet are all practical steps you can take right now. These changes work together to reduce joint stress, improve flexibility, and help prevent the progression of joint-related conditions such as osteoarthritis. Maintaining strong, healthy joints is essential for preserving your independence and quality of life as you age. Your joints support every movement you make, from getting out of bed in the morning to enjoying activities with family and friends. By taking proactive care of them today, you are investing in many more years of comfortable, active living. Remember, your joints are the foundation of your mobility. Treat them with the respect and attention they deserve, and they will continue to support you reliably for decades to come.